Joining me right now is JODIE ALTMAN. She is the Director of Residential Treatment here on the campus. And we're hearing more than ever, JODIE, now about mental health. But there's a big connection with substance abuse and mental health, isn't there?
There is, and there's always been a connection. It's just more, I think COVID really brought it to the forefront. We can't treat one without the other. Oftentimes what we see with our kids is that they're self-medicating. They know there's a mental health issue, but it's easier to smoke pot, to use drugs to help themselves treat it.
Of course, and the kids are probably not aware at all that what they're feeling is a mental health issue. So how can parents know the difference? What are some of the watch signs?
Parents know your kids. They know their kids better than anybody, so when you see your kids change their friends, change their behaviors, change their personal hygiene, change the way they interact at home, those are all red flags. The best thing parents can do is just ask the question. Never be afraid that it's going to be a dumb question.
And I know that's always a problem with parents, right? I mean, it's approaching the kid, not wanting to be confrontational necessarily, but I'm assuming there's some help out there for parents that need to know what it is they should be saying or doing.
Absolutely. That's where we come in. If you call us at 827-9462, we can help you either sit down with you and your child, or we can help talk you through it, just so that you know you've done everything you can for your child.
And it's at whatever stage, right? Because it doesn't mean that if you automatically make the call, you're signing your child up for residential treatment.
One has nothing to do with the other. If you make the call, you're asking for help and you're asking for direction, and that's the best that you can do.
Awesome. Tremendous resource here on the campus for kids escaping drugs. JODIE, thank you very much for that. We've got more to share with you about the wonderful volunteers we have here working with us today, as well as some of the other important things going on campus.